Alaska has some of the most amazing and beautiful scenery in the world, a frozen wonderland for much of the year, with lush greenery and sparkling waterways during the warmer weather. Outdoor lovers and winter sports enthusiasts enjoy a bounty of activities. But Alaska is also a state where providing physical and behavioral health care in some regions is a challenge.
Alaska, we're talking about frontier and really remote healthcare where, only a third of the state is on the road system. So how you deliver care really makes, it's very different than the rest of the world. It's a lot of, you do spend a lot of time flying into villages. We do a lot of telehealth.
And I would say Alaska is trauma rich. Through history, there's a lot of historical trauma, there's intergenerational trauma that is carried forward. And so, you're working through a lot of that with folks who are ready to work through that.
There is a growing need in Alaska for behavioral health care. The Alaska Delta Center team included the Alaska Primary Care Association and the Alaska Behavioral Health Association, where John Solomon is CEO and Lance Johnson is COO. As their Delta Center project, the team worked to remove a policy barrier so behavioral health providers can better serve the needs of Alaskans.
We're seeing a significant increase in folks that are unhoused. We're seeing an increase in families having really, big challenges with substance use and things like that.
Dustin Larna is CEO of Residential Health, which operates residential youth care known as RYC. It's located on the small island of Ketchikan in the southeast corner of Alaska. The need for behavioral health is significant statewide, but in addition to the remoteness, there's another barrier that behavioral health providers are facing as they try and deliver care to all who need it.
I think, the kind of administrative burden or, all of that extra work that distracts from actually helping people.
The paperwork for behavioral health providers has escalated into a complicated administrative burden, primarily due to service authorizations. A service authorization is an approval that providers have to get before delivering a particular treatment or service. These authorizations are required by most private insurance companies and government insurance like Medicaid, and must be done before providers receive payment.
They were put in place as a cost containment effort, really looking at, making sure that there was no fraud, abuse, or, waste, all of the things that we have to look at as a state.
However, behavioral health care providers can spend up to 2 hours per patient on service authorizations.
They have to cut out an hour or two to do treatment or service authorizations. You're taking that away from clinical time, and there is zero clinical value to service authorizations.
And so you end up spending more time on your documentation and making sure that your documentation is the best that it can be than being the best you can be for our youth. And that is not why we're here. That's not why we're doing this. That's not what our focus should be on.
Behavioral health providers believe the root of the paperwork burden lies in the perceptions of behavioral health care decades ago.
So these early regulations are rooted, I think, deeply in stigma. And a lot of these extra requirements that still exist, I think, came from a time when providers were you could provide services, but you got to prove every step of the way that what you're doing is meaningful.
Dustin is president of the board of directors of the Alaska Behavioral Health Association, known as ABHA. The organization provides education, support, and advocacy for behavioral health providers. With support from the Delta Center for a Thriving Safety Net, ABHA formed a plan to address the administrative burden. ABHA asked federal regulators this question:
Do states have to have service authorizations for behavioral health? Well, CMS just said, no, states just have to have a mechanism for people to prove medical necessity. And traditionally, people have used service authorizations for that, but that is not the way that, CMS does not require that.
While those conversations were underway, the COVID-19 pandemic unfolded, prompting a health emergency. State officials finally relented on the service authorizations.
The division did look at, what were some of the regulations that could potentially be suspended, just kind of trying to make life easier during a really stressful and difficult time for the world. Service authorizations and suspending those service authorizations was really one of those things that was identified by the division.
So that is a huge reduction in administrative burden. That revamp came about from them listening to the feedback that we gave them from the original services, and we were heard. We didn't get everything we wanted, but we also weren't ignored. It really is working together.
The Alaska Behavioral Health Association is working towards a smoother, more open relationship with state regulators to continue improving behavioral health care for Alaskans.